Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. This is our weekly COVID-19 update for February 26, 2021. falmouthma.gov is our website. health@falmouthma.gov is our email. Non-COVID sort of contact tracing guidance sort of calls, general sort of COVID stuff, 508-495-7485. There's also a county COVID hotline at 774-330-3001. So here we are, several weeks into the vaccination process. Eligibility is all phase 1 priority groups, 75 and older, 65 and older, and any individual with two certain medical conditions are called comorbidities. And that's where we are, which is started about a week ago, with the step 2 in phase 2. Obviously, there's not a lot of vaccine around. The state's getting about 100 to 130,000 doses per week. So with it opening up to well over 1 million, probably more close to 2 million, it's obviously a big fight over getting the vaccine. So it's been really difficult and long waits and refresh buttons and this, on this program, but it is what it is. You're supposed to register online for an appointment through the state at the mass.gov website. If you don't have it bookmarked, you haven't been there, that's where you would register. The state, for those who cannot register online, you can dial 211. The town is prepared to assist residents who don't have an internet access with booking vaccine appointments, but due to the limited supply of vaccine, the town is deferring the launch of that hotline. It wouldn't make a lot of sense if you have to wait 6 hours and keep hitting refresh in order to maybe get an appointment. Having a lot of residents call to do that is not really productive. So at this point, until there's more vaccine available, then we'll stand up that call center to help it. So it's going to be similar to 211. It's those that do not have internet access. But right now, yesterday they released some vaccine appointments and they were gone. And the wait lines were immense over there on the website. So right now, there's just not a lot of vaccine, and so that's where we're at. If you're over 60, it would be a good idea to enroll with the Senior Center for updates. So you can dial 508-540-0196. Those are like robocalls, blast emails. We also update the website at the town, but also that is also a great place for you to get the most current information. And Municipal County also has a call center helpline at 774-330-3001, like I had mentioned before, but that's not for registration. So you could call 211 for registration. Somebody's just going to go online and see if there's any available appointments. Right now, they'll probably tell you no, or they could tell you there's something, 100 miles away. It's going to be based on luck if you do not have internet access or the ability to use a computer. And it's unfortunate, but it is the way it is, and it's got to do with the amount of its supply and demand. There's not a lot of supply, a lot of demand. Vaccine supply is obviously in short supply. The Mass Department of Public Health is allocating most of the vaccines from the federal government to mass vaccination sites in the 20 communities that have the greatest burden. Barnstable County Health and the Environment is getting about 1,170 doses per week. For the next few weeks, those 1,170 are going for second doses for clinics that they had run previously. Doses will be running through the county vaccination sites as more vaccine arrives, more vaccinations will occur. There's plenty of ability to do a lot of vaccines out of the regional sites. Could also do them locally, but that's, at the high school, we could do a lot of clinics. We have a lot of volunteers, we have a lot of nurses, we have the ability, it's just a lack of vaccine. So the vaccination sites the mass vaccination sites are Gillette and Dartmouth. Okay, the regional sites, the Melody tent's going to be replaced with the 4 Cs. The Barnstable County Fairgrounds, there's DPW at Orleans, and there's a couple Eastham Lower Cape. And also local pharmacies, more should be coming online. East Falmouth CVS, the Walgreens in Mashpee. If you're a veteran at 55 and older, vaccinations are available in Brockton, West Roxbury, and Jamaica. You just go on Vaccines for Veterans. You can get that live link from our website, the COVID page on the falmouthma.gov website. If you are a veteran, you will have to go to Brockton to get it at the VA hospital, but there is availability there. We're still a couple weeks from getting, maybe longer, from getting a good supply in where we'd be able to really take care of more vaccinations. everybody's partnered up, we're all ready to go, but it is what it is. Now, some good news that came out, if you read the Cape Cod Times, I think it'll also be in the Enterprise today, but the Cape Cod Regional Vaccine Consortium, they're working to obtaining doses from the state through Cape Cod Healthcare to vaccinate at 4Cs. So 4Cs could be used by Cape Cod Healthcare and Barnstable County. For the region's most vulnerable residents and senior citizen. The idea is not to have an online registration. The details, I don't have all the details to give you right now about it. It's just sort of real fresh. The idea is to get our vulnerable residents through it. And also working on getting doses for communities to use it for the homebound, which are those that can't make it to a clinic. So that's been in the works this week. I'm sure it's something we really want to go on. The article, you can read the article in the Cape Cod Times, and that would be great. And essentially, we would provide everybody who meets that criteria a list to Cape Cod Healthcare. Cape Cod Healthcare would work through the list. So all the details, we'll put it on our website when we have good details and instructions on it. It'll be on our website. Probably do a media release. It'll obviously be on next week's presentation. But the nitty gritty still we'll post as soon as it's all been worked out. Obviously, the goal is to reach those eligible for vaccines who have been left out by the getting the golden ticket to go to the chocolate factory sort of system that we have currently for the few vaccines that are around. So that's good news. That's real good news if all that comes to bear. As far as doses, Barnstable County gained 10,545 vaccinations were completed at Barnstable County residents this week. This is just the state's gives this vaccine update on a weekly basis on Thursdays. So from last Thursday to this Thursday, the number was increased by 10,545. With the low amount that's on the Cape, most people had to travel to go get it, and some people have, and that's where we're at. You can see that Suffolk, Middlesex, and Essex have had the highest. They're also the highest population and also have had the highest infection rates. So that's where a lot of the vaccine has been going. As far as by county, we're up 4.8%, 17.6% of the doses have been shipped to these various counties. That's a bit low from, as far as I'm concerned, for Barnstable County, because Barnstable County is similar to Berkshire on the far end of the state. We should be in that 20-something, 24% range as well, because of the eligible population includes 65 and 75, and we have more 65 and 75 as a percentage of our population than most any other county. So, I still find that number to be quite low. And hopefully what's working with the consortium and Cape Cod Healthcare and what Barnstable County gets will make that number get a lot higher. This number as well is about percentage of residents with first dose administered is 19.9, so basically 20%, which is up 4.8%. Second doses, because a lot of people just got their first recently, then the second doses will obviously tail behind, is up 1.8%. So that's it about vaccine. You just keep bearing down on the online registration process. Pay attention to updates on our website. Pay attention to phone blasts from the senior center. We'll get the information out as best we can when we have details on how that whole thing's going to work with Cape Cod Healthcare. So that's what we have for vaccines. The supply will get better. One other thing is the Johnson & Johnson was just approved, which is a single dose. Which will make things quite a bit easier as far as trying to register for second doses, and the fact that one person has to go through twice. And so that's going to be coming down the pipeline, hopefully relatively quick. In terms of case counts, 1,177 cases since March 19th. I did forget to update the probables. That's last week's probables numbers. I did just notice that. 35 confirmed cases during the 7-day period of last week from the 18th to the 25th, which is a little bit higher than what we had last week, the week before. About 97% of our no longer in isolation, and we remain right around that 11.8% of all cases, with 14% being expected. And of course, we just continue to do the contact tracing with the VNA, the CTC, and the health department. We still do the things that we do every day since this started, with the contact tracing on each case. So our case trend, if you look, you can see that we had a couple of really good weeks comparatively to what we've been having since December, in the 25 and then down to 23, but we've bumped up to 35. Some of that is travel related. We have seen that some of it's got to do with flights and got to do with travel. It was school vacation week last week. I hope we don't have, this next week will be the week that we'd really see sort of that happening one way or the other. But you do see a slight increase. There has been, but still in a much better spot than we were in January. Our curve was starting to flat a little bit in the last couple of weeks, and with this little uptick, it's not quite as flat. But again, we'll really see what happened after school vacation week. Probably starting next week is when you started to see it a little bit this week, but we'll see really by the weekend and into early next week. Cases, again, 43 cases, and if we're greater than 5% positivity, we're red. Less than 5% positivity, we're yellow. 43 or more cases, we're either going to be yellow or red. Less than 43, we can go to the green. You can see that Falmouth is still yellow. We're slightly higher. We went from 1.90 to 2.16, and this is the time frame. The data has ended on, so it's the 2 weeks prior to the 23rd. You can see that we're a little bit higher, but still well into yellow. Barnstable County, we're still better than them in both percentage and in daily incidence rate, and definitely twice as good in terms of incidence rate for the state, even though the positivity we've been about the same with percent positivity. So pretty good, though we've had slight increase over the week. This chart shows you each town. You can see there's more yellows and greens. We were the one town that did trend slightly higher. Hopefully that doesn't continue, but we all do. This is the first time I've seen this without a sea of red. It shows that most communities are in the yellow, with a couple communities that have been green. The Outer Cape is, some of those towns have remained gray, mainly due to, they're pretty well spread out there and seem to be hanging home. Barnstable County's numbers, again, the peak was in that mid-January range, and you can see it's gone down, and the lowest week was actually like last week, and this week is a little bit higher, but not necessarily a trend, I hope. As far as all counties together, this is the Barnstable County testing, so this is percent positivity. You see Falmouth sort of in the middle here. Barnstable and Bourne and Orleans had a higher positivity, in Yarmouth. We didn't do quite as well as, let's say, Sandwich this particular week, and about the same as Brewster, a little bit worse than Brewster. But percent positivity, we're not doing, like I said, we're not doing too bad with that. As far as cases throughout the state, they're pretty flat. I think last week it was somewhere a little under 2,000. We're right around a little under 2,000 daily cases. We're under 1,000 people in the hospital. Relatively flat on a percent positivity. It's gotten below 2, which is great. Test times have been a little bit quicker turnaround on tests, 1.36 days for a turnaround on a PCR test is about as low as I've seen it in a while. Deaths are starting to tail off a little bit, mainly, obviously when cases are high, there's a delay of several weeks, even a month, before the deaths would show as a decline, just because people, when they do get real sick, tend to be in the hospital for quite some time. So we're pretty flat with that. Hopefully we can keep it down. Same thing with our trends. There's a bit of a flattening of this last week, but everything shows everything in a good direction. Hospitalization, so the 225 data, the last one I have, shows 2 at Falmouth Hospital, 1 in the ICU, and 12 and 2 at Cape Cod Hospital. Those numbers are definitely a lot better than they were in January. So great. And then that just is great. Testing hasn't changed. Drive-through at the hospital is still there. You can still go to the pharmacies like CVS, walk-in clinics like Convenient MD, Community Health Center of Cape Cod as well. If you want it, on Tuesdays, they do a drive-through. It's free. It's drive-through testing at Barnstable County Fairgrounds. You can call the fairgrounds directly at 508-563-3200 from 8 to 2 Monday through Friday. They do it once a week. They go to the same place that we do vaccinations in the big barn. It's a drive-through, so you can call the fairgrounds directly, and they've been nice enough to book that for us, which is just great. Wendy's been great over there. Everybody at the fairgrounds has been great with the clinics we're trying to run out of there. Hopefully we run a lot more clinics out of there, and also with the testing, so thanks very much to the fairgrounds. The governor yesterday is effective March 1st, but let us know yesterday that there's some change in the guidance. So effective March 1st, restaurants are no longer subject to a percentage seating capacity. There are limitations based on spacing, which they used to have. So it's not, you don't have to limit the number of people, you just have to have enough space to spread everybody out. They will begin allowing musical performance with distancing, still a 90-minute time slot on tables, and no more 6 per table, and any food court self-service would still remain closed. Gathering limits have been increased from 100 to 100 indoor, 150 outdoor in event venues and public settings. Private settings is 10 and 25. It increased to 15 capacity in a lot of the different areas, libraries, school, different types of flight school. We don't have one of those. Places of worship, operators of lodging. Office spaces, I crossed that out because obviously they would have to, if they exempted all employees on an office space, that would be everybody there, so that had been taken out. So we do have some opening up of this. So there's some opening up based on the data that we've had, and then we're starting to get the vaccines done, even though at a lower rate we'd all like. But you do see that he is loosening things up starting March 1st. Starting March 22nd, some of the phase 4, step 1 will come in. So indoor, outdoor stadium, so you can go to a ball game now with a 12% capacity limit. A large venue is defined as having a capacity of 5,000 or more. Under 5,000 is subject to the indoor-outdoor performance venue guides that you have, we showed previously. Obviously, they'll have to have a plan in place. So there's some March 22nd. Again, that is all subject to public health data. If we have another spike or the cases start to go up, then he would retract that. All that guidance is online. If you're a business and you're interested in everything I just said, we'll be glancing over it. Then you would just go to the mass.gov and you look up what they call sector-specific guidance, and you can get all the information there. You can always call the health department. We do answer a lot of questions on that. Again, social distancing, face mask, all the same stuff still into effect. Stay at home when ill, self-isolating. Hopefully everybody who traveled, quarantined upon arrival, got a test based on the guidance. I still need to avoid the indoor non-social distancing things like parties and so forth is still an issue. But still need to stay diligent until the vaccines get to you. And so, just try to keep yourself safe. So as a recap, state metrics are stable. Falmouth remains yellow. We had a slight increase. Well, 34% is not slight, but, week to week, you do get some fluctuation. Still much better than it was in January. There's still opportunities for community spread. Regionally, vaccine being administered as it arrives. The supply will get better. If Cape Cod Healthcare in the state would work something out where they can do some vaccination at 4Cs, especially for those that can't use the computer. The 75 plus, 80 plus, real tough to do with an online registration process. So trying to circumvent that, hopefully that all comes out and we'll get that information out to you. Again, you still have the mass vac sites and pharmacies, so you need to keep checking if you don't necessarily fall into that most vulnerable group and you're good with the computer and you can get to places. The mass vac sites are still going to be the place to get it, and pharmacies as well. And the final guidance, the state has loosened up some of the guidance. So that's the update. Hopefully things keep getting better as far as our supply, and we'll all get there at some point. And that's it for this week, and we'll see you guys next week. Thanks.